This meeting is being recorded.
Hello, everyone. This is Dr. Siddharth Dambar. Welcome to our webinar today. Today, we are talking about peptide options for weight loss. So great. This is an exciting topic in large part because there's so much more that we can do to help people out with weight loss and metabolic health that we really couldn't do in the past. This is really critical for a lot of my patients who either are living with chronic inflammation or have a lot of chronic joint issues, in particular lower back and knee, foot, ankle issues, in that we can really help them out in terms of inflammation and weight loss as well. So in today's talk, we're talking about our weight loss program here at Chicago Arthritis and Rheumatoid Medicine, talking about some of the newer peptide options as well. Briefly, we all know this already, of course, but scope of the problem with obesity. Obesity is a global health concern. It's really an epidemic here in the United States. The sheer number of people that are affected is really enormous, and the effects that it has in terms of not only adults, but also the health for children is absolutely astronomical. And we really need better treatment options for all of us. Okay, good. So in terms of health effects of obesity, we all know this, but it's always worthwhile to reiterate it. To begin with, musculoskeletal problems, that's obviously what I see every day, especially lower back and lower extremity arthritis issues. Cardiovascular consequences are dramatically worse with weight issues. Metabolic effects, when you're talking about things like diabetes and high blood pressure, go part and parcel with obesity. There's even immunologic implications. We know that people are more prone to infections, certain types of infections, skin infections. And we know that certain autoimmune conditions, including psoriasis and psoriatic arthritis, are worse as well. And as it turns out, there's also higher rates of various cancers as well. Sleep apnea is another one that's, of course, connected with cardiovascular issues also. So we really need better and effective weight loss options, in that we know that obesity poses tons of other problems, and there's really limitations with our traditional methods. Diet and exercise are key. It's not adequate for many people. Conventional weight loss strategies work, but sometimes unsustainable and yield limited effects. We know that weight loss or obesity is more than just a matter of motivation, that there's a lot more involved in it as well, that losing weight has aspects connected with biologic, genetics, physiologic, environmental factors. It's much more complicated. And so we're trying to offer a weight loss program that really attends to all those things. Our goals of treatment are as follows. Certainly not only losing weight, but to improve body composition, improving not only losing fat, but also maintaining or increasing muscle mass and reducing visceral fat that's really connected with cardiovascular issues. Improving your risk factors when it comes to cardiac, metabolic health, improving your exercise capacity, improving your eating habits long-term, improving your immune and gut health, and improving sleep and stress management as well. So there's 3 ways that diet can help with weight loss. Each one of these is key. Number 1 is you eat less than you're expending. So if your intake is less than your output, you will lose weight, guaranteed. Number 2 is you eat less of specific foods. But the question is, which foods should you eat less of? When you look amongst general population, when you look at what people think is helpful for weight loss, you see people who are doing everything from one extreme to the other. There are people who believe in hardcore carnivore diet, only meat, no plants or vegetables. And then you have people who are hardcore vegans who believe in no animal fats or animal products. And so when you really look at your medical societies, they take more of a middle of the road process. And they generally recommend things like a Mediterranean diet, which is more balanced, less red meat, less processed foods, more vegetables, more lean meats. Common sense, probably a good option for most people. But again, depends on the person. Your body may respond better to one option than the other. And then there's when do you eat, right? Time restricted eating. Intermittent fasting is the concept that you fast for 16 hours and you eat for 8-hour blocks, meaning you can eat during those 8 hours. So the classic one is you start your first meal at 10 a.m. and you eat your last meal at 6 p.m. Makes a lot of sense. Seems to help with some metabolic risk factor issues and makes sense to not be eating too late anyway. So all three of these have a component to help with weight loss, and I think all three should be utilized. So for folks who need more than that, peptides are really an innovative therapeutic tool that's been out for the last few years that are really revolutionizing folks' metabolic health, folks' weight loss as well. So peptides are proteins that naturally occur in your body, that your body's naturally producing, that essentially tell your cells what to do. So peptides utilize pathways that are already in your body, and there are synthetic versions of these peptides that essentially mimic or are similar to what your body is already creating. And so they're utilizing your body's own natural pathways. That's good because number one, it's utilizing a normal process in your body as opposed to an artificial one. And number two, your body can only go so far in that pathway. So there's a certain amount of restrictions for how strong that can be, which is a good thing when it comes to treating you with any kind of medical treatment. And so it tends to have lesser side effects than some of the other prior generation of weight loss medications. Peptides are available now, and they are definitely the future of medicine as well. So we're really focusing on the GLP-1 agonists. That's the one that you hear a lot about. Things like Ozempic, Wegovy, those are the ones that you hear about. So GLP-1 agonist, GLP-1 stands for glucagon-like peptide 1. This is a hormone that your gut is normally producing that regulates appetite, insulin secretion, energy metabolism, all the things that are essential when it comes to metabolism and weight loss. There are other peptide targets that are currently already being utilized. That includes not only GLP-1, but GIP, GCG. You probably hear about some of these meds, things like semaglutide, tirzepatide, and now the newer one is retatrutide. They have a key role in glucose or blood sugar control and insulin secretion. This is why they were originally approved for diabetes. Incidentally, they found that people were losing weight as well. So key role not only in controlling your blood sugar, but also in your overall metabolic health and also in weight loss. So this is a game changer in terms of weight loss. Semaglutide is the non-branded name for treatments like Ozempic and Wegovy. And semaglutide is a GLP-1 analog, means that it mimics the effects of your naturally occurring GLP-1. Really remarkable efficacy in terms of promoting weight loss, improving metabolic health, works by getting your body to absorb or utilize blood sugar more efficiently into the muscles, helps to slow down the overall processing of food through your gut, and also reduces that sense of food chatter that people have, like feeling hungry frequently. And so all this combined is what helps people with metabolic health, which has far-reaching effects, which we'll talk about in a moment, and also helps people eat less. So you are processing blood sugar better, you're eating less as well. All that is what leads to pretty significant weight loss as well. Tirzepatide is the other one that's commonly available right now. Both of these are mechanisms of actions that they help to control your appetite and weight through the brain-gut axis, slowing how fast the food is getting through your gut, reducing that food chatter or hunger sensations, helping you to feel fuller sooner, reducing food cravings, reducing food preferences. So you're not necessarily hangering for certain foods that are really not healthy for you, a lot of processed foods, and just reducing the overall thoughts about food. So semaglutide and tirzepatide are currently approved for type 2 diabetes and chronic weight management in adults, including in folks who are obese, over a BMI of over 30, BMI has some limitations, but the reality is that your BMI is what's utilized in so many studies. And so it's a helpful number to follow. But it's also approved in folks who are not as heavy, have a BMI of over 27, but also have another weight-related possible medical issue. It's a wide number of things that they covered under. That includes high blood pressure, diabetes, cholesterol, osteoarthritis, fatty liver, prediabetes, heartburn, PCOS, hypogonadism, asthma, just so many different things. And other potential future preventative indications that a lot of us are excited about are, could this help to prevent cardiovascular disease in folks who are at higher risk? Could this help in pre-diabetic patients, but could it even help prevent prediabetes? So anytime you hear of gestational diabetes, meaning women who are pregnant who have a high blood sugar, those women are then at higher risk for diabetes long-term as well. Imagine if you knew someone was more prone to diabetes because of their family, could you prevent that from occurring? Prevention is so much better than trying to treat something once it's there. Exciting indication. Neurodegenerative diseases, there have been some studies that have shown that the risk of developing or more severity of Alzheimer's is reduced on these kind of treatments. Because of this improvement in metabolic health, the thought is there some benefit in this in lower dosages, even as an anti-aging treatment? When you think about what leads to aging and all the things that come with aging, you're talking about a complex metabolic process where your body is now changing due to changes in hormone status, changes in overall metabolic health, which then leads to so many different things, whether it's our musculoskeletal system, our endocrine and diabetic system, our blood sugar system, our cardiovascular system, our kind of brain system, like all of it, our neurologic system is affected by these metabolic changes that occur over time. So an exciting idea that can we have a low risk option that can help to slow down or prevent those changes from happening? Many years away from proving that, of course, but an exciting concept that at least makes sense in theory. So the way peptides are utilized, a protocol, it's essentially you're injecting yourself subcutaneously once per week. You start on a low dose, that's key, and then you slowly go up. If you start too high or if you go up too fast, you're more at risk for developing side effects. Your physician should monitor your weight, appetite, observe for any side effects monthly, and monitor your metabolic health labs every 6 months. One of the issues with, if you're getting this from some of the larger internet providers that are doing these kind of treatments, is that they are more about delivering the medication as opposed to actually managing your treatment, which is not ideal because this is still a medical treatment. You still want to have this properly managed. So sustainable weight loss within reach, when you look at the clinical studies that are out there for semaglutide and tirzepatide, really quite impressive. When you start looking at over 1 year results, 2 year results, you start to find that there is dramatic, on average, degree of weight loss. For semaglutide, it's on average 15%. For tirzepatide, it's closer to 20%. What's exciting about that is those are average results. So when you look at average results, there's some people who are really good with their nutrition and diet, some people who are not. So an average result, that's very good. If you do a good job with nutrition and regular exercise, you'll maximize your results and do even better. And the safety profile is pretty darn good so far over the last few years. No medical treatment has no side effects. The same thing here, but these are dramatically better than the side effects that we saw with prior generation of weight loss treatments. So the most common side effects are generally mild GI issues, nausea and constipation. Anytime you give something to a lot of people, you can see some people that have a little bit more extreme side effects. The keys are titrate up slowly, keep an eye for the side effects. Your physician should be watching closely. If you do those 3 things, you can do this safely. The other type of treatment that we like for weight loss these days are lipotropics. These are essentially an injection of various vitamins and amino acids that help in terms of your energy level, metabolic health, and also aid in weight loss. These are milder than the peptides, milder than the GLP-1 agonists, but they're a good augmentation. Generally healthy for you, generally help with metabolism and weight loss as well. I think even utilizing these in combination with the peptides you can give yourself an even better result. Again, you inject yourself intramuscular IM. We show you how to do this once per week. Helps in a lot of different ways, but definitely helps in terms of metabolic health. Health coaching, I think this is really key. Nutritional health coaching is key. I think if you can work with a nutritionist or a health coach that can help out with understanding what's right for you and then helping to keep you accountable. When you look at what it takes to create a new habit, there's some folks who say it takes 60 to 90 days. I think if you have that kind of accountability and coaching that's helping you out, you can get to that kind of goal, which is exciting. The keys to optimized treatment, in my opinion, if you fail conservative options, are peptides, lipotropics, regular exercise, regular nutrition with health coaching to help you along the way as well. When it comes to nutrition, eating nutrient-dense food is key, avoiding overeating. You'll feel hungry at some point. Make sure you're eating good quality food at that point. Exercise. Cardiovascular exercise is very helpful for your weight loss and improving your metabolic health. You have to do that. The thing about these treatments is that you do also have to do strength training to protect from muscle loss. That's very key. When you lose weight, your body doesn't know whether you're losing fat or muscle. It's just, you're just burning off tissue, right? Excess calories. So it's key that you're doing some strength training to maintain your muscle mass as well, so that in the end, you're improving not only weight loss, but you're also improving your overall body composition by maintaining your muscle mass as well. There are other types of peptides out there as well. There are peptides that seem to work on the growth hormone axis. They boost metabolism, increase fat burning, help the body build lean muscle. There's a few of these out there that are worthwhile considering if you need that as well. I think the future of treatment for weight loss and metabolic health will be combining a couple different peptides as needed based on what you need, and then other medications if needed, and then maximizing what you can do from a nutrition standpoint, exercise standpoint, so that we can do an even better job long-term. With any of these peptides, when you utilize them, you should use them with appropriate medical supervision. You should be aware of potential risks, and you should know how to prevent them. And the key is always follow closely with your physician, start low, slowly escalate. You do that, you'll get a good result. Also keep in mind that some of these treatments, like semaglutide and tirzepatide, have a lot of published evidence. Some of these have much less published evidence, like the growth hormone agonists. But they do have positive physician experience. The key is you want to be cautious if you have any other serious medical issue. Your physician needs to know that. Again, I keep on saying this, but follow with an experienced, knowledgeable physician. And be aware some of these treatments do better if you take some breaks in their treatment cycles. And again, combining peptides is the future, is starting to happen in the present. I think if you combine all this together, you can get a great outcome. Keep in mind, this is not a quick fix. Slow and steady wins a race. And as always, work with a knowledgeable physician. Your physician needs to be aware of a lot of things here, by the way. They need to be aware of the FDA issues. The FDA does have control of what we can utilize medically. And folks, they need to know what is safe and what is appropriate. They need to understand the potential issues with compounding pharmacies, what is safe to use, what is available to use. And your physician needs to understand that with the regulatory environment, things are always in a dynamic state of flux, and they need to be able to guide you through this, even if a treatment is no longer available. How do you adjust and then utilize the next thing? So in the last 6 months, like you've heard, tirzepatide has been not available through compounding pharmacies. Semaglutide is now not being as easily available. Some of these are still available. Some of these you have to go through the brand name. Your physician needs to guide you through here. They may need to change to a different peptide. They may need to change to a different peptide combination. But again, always be patient. These things are slowly working out over time, and your physician can guide you through this appropriately. If they can't, to be honest with you, you need to probably find another physician. Part of being a physician is being able to create a personalized treatment plan for you. And part of that is, what are you able to use? What can you not use? And what can you safely use? And what is available from a regulatory standpoint? A lot of frequently asked questions that I commonly hear from folks. Number one is, how long before I see weight loss? You'll probably notice some early weight loss in the first month. You'll notice definitely some changes in appetite in that first month. But you do need to give it at least minimum 3 months. I would really say up to 6 months to see how well is it working. Always start on a low dose and slowly escalate. On average, folks will lose 15 to 20% of their body weight if they're on it for a year to 2 years. How long do you need to continue treatment? That initial period really should be for 6 months. When you look at the effectiveness of peptides, most effective for chronic weight loss management, not just as like you're on it for a couple of months and you're off. A lower maintenance dose is possible, and be aware that some peptides may need to be cycled. So you're on it for some time, then off it, then back on it. It's kind of an odd question, but do you need to eat healthy and exercise if you're on these meds, these treatments? Someone actually asked me that before. And the answer is yes, absolutely, for optimal results. You have to keep in mind that the goal is not only weight loss, it is body composition and keeping you overall healthy long term. You do that because even as you're losing weight, you still have to eat the right foods, the right macros, the right nutrition, and you have to do the right exercises. If you do all that, then you'll actually do well. So yes, I would say it's absolutely still essential to eat healthy and exercise. Can semaglutide and tirzepatide make your muscles and bones weaker? Look, as you lose weight, you do lose fat and muscle. So by focusing on body composition, by doing the right resistance exercises, you can maintain your muscle and actually improve it. If you don't, then yes, you'll lose muscle. And if you lose muscle, then your bones can get weaker as well. So you have to do the right exercises to maintain your muscle and bone health. And again, if needed, combined with other peptides that actually work on that. Another interesting question I've heard is somebody saying they already don't eat much. Will this treatment still help? Yes, it can still assist. It'll help with your metabolic health, which has far-ranging effects besides weight loss in terms of helping your overall body. And also keep in mind that lipotropics are another option that can help regardless of how much you eat. If you stop treatment, will you regain all the weight? Studies show that if you stop treatment, then you'll regain 2/3 of your weight if you do nothing else. The key is that you need to continue to eat healthy and exercise. That's how you maintain your weight loss if you stop treatment. So should you use these peptides long-term? I would say consider it, right? It helps significantly from a metabolic standpoint, not only a weight loss standpoint. The effectiveness and safety study goes over 2 years now. Your maintenance dose may be lower in dose and or frequency. And then how do peptides compare to other prior weight loss meds? Again, it's night and day. Peptides lead to more weight loss and they're safer. That's exciting because that means we're saying it works better and it's less risky. So absolutely great option for folks who need to lose weight long-term. Our program utilizes physician-assisted weight loss program. We're utilizing peptides and lipotropics, starting with a thorough physician examination to begin with. Our team is here and trained to handle issues that can happen with treatment, continuous monitoring, continuous adjustment, regular lab monitoring every 6 months to make sure things are being done safely and carefully, and emphasizing the weight loss component of nutrition, diet, and exercise as well. To learn more, you can see our QR code there and click on that. Our costs are listed there as well. The age of peptides is definitely here when it comes to weight loss and metabolic health. Excited to continue on this road with folks because it's helping a lot. Well, we are coming to a close to our webinar today. If there's no other questions, understand you can contact us at any time via our website, chicagoarthritis.com, or via any of our social media sites. If you have any other questions or would like to learn more, please let us know. Until next time, have a good day and live well. Bye-bye.